Good afternoon, everybody. This is Tara, and I am coming to you live from the Core at Law in Cantata. We are here getting ready to live stream the first lecture of a summer lecture series that we have with our awesome team at the Cardiac Rehab Department. Some of you that have been to the Core for our lectures and classes in the past may recognize our speaker for today. In the years prior, Sabine Harrington, who is going to be presenting here shortly, has done a lot of things for us at the Core. Her most recent and current role is an exercise physiologist with our TMC Cardiac Rehab program. We're really excited to have her, as well as her colleagues in the upcoming months, here to present on a variety of different topics that will impact your health and wellness over the summer months, talk about your heart, and ultimately what we can do to help you stay healthy this summer and beyond. So for those of you watching online, a couple of quick things to help you make sure that you get the most out of your experience. We have a live studio audience as well here with us at the Core. They may be asking questions periodically. Do know you have the option to ask questions as well. You type those in if you're watching on Facebook or YouTube. We have somebody here that is going to get those to Sabine at the end of the talk, and we will make sure that we get those questions addressed. Otherwise, if you're having any audio, visual issues, we have somebody watching those too. So please send us a quick note if for any reason you can't hear us, you can't see us, and we'll do what we can to help that. After this talk is done, tell your friends, tell your family, because you will want to share this content. I've seen the presentation and it's really good. They can find it on our YouTube channel just by searching Tucson Medical Center. No account is needed, no subscription required. So without further ado, I'm going to go ahead and hand things over to Sabine so she can get her topic on summer heat and the cardiovascular system started. Sabine, take it away.
Thank you, Tara. All right, thank you so much for everybody that's tuning in, and thanks for the live audience. As Tara mentioned, I did give some presentations here at the Core years ago, and it's coming full circle now that I'm part of the TMC team. And I've always had an interest in environmental physiology, especially because we live in an extreme environment. So today's talk is about how our cardiovascular systems adapt to heat. And there's really no way around it. We live in Tucson, so whether you like heat or not, you are going to adapt somewhat. So my main goals today, number one, is to talk about what's physiologically happening with heat adaptation. And then how does that impact you depending on what your goals are? So if you're an athlete or even just a weekend warrior that wants to stay fit and not get lazy during the summer and you do go outside, you know, how does heat stress impact your heart in some good and bad ways? And then if you have a chronic condition, I do want to touch on the clinical population because I work with them now. How does heat stress impact that depending on if you have congestive heart or some other condition? So I'm going to touch on a little bit of everything, and hopefully there'll be something for everyone. So let's get into it. So I'll start off by saying that as humans, we actually have a couple of things we can feel really good about physiologically. We may be a lot weaker than other animals in a lot of different ways, but as far as our ability to actually adapt to heat and dissipate heat, we are excellent at it. Most animals would perish in the situations that we can actually survive in. Doesn't mean it's comfortable, but we can actually handle it if we acclimate. We also can outwalk almost anything. And those two adaptations probably evolutionarily came together. And we'll focus more on the heat today, but just know that there are a lot of endurance training benefits that you get from simply acclimating to heat. They really do go hand in hand. So I'll start with a few definitions. I have really dense slides, and I'm not going to read through all of them because it's just going to be too much. But I am going to talk about this right here. So one of the main things that's going to acclimate or adapt to heat is your blood volume. Your blood volume will actually start increasing within the first few hours, first day or two of being exposed to heat. And that's assuming you're drinking enough water. That probably won't work so well if you're not drinking enough water. But that plasma volume expands very quickly, and red blood cells also increase later. So it's almost like a legal performance enhancer if you think of it that way. What is cardiac output? It's the volume of blood or stroke volume times your heart rate. And that's the liters of blood per minute that's circulated around your body. So this is something that athletes will care about. Clinically, we measure this as well. And I'm going to show you what happens with heat. So There's acute or short-term responses and then longer-term responses. So when you're first exposed to heat, maybe it's that first day here that's above 100 and everyone feels like they're wilting and your plants are wilting too. Everything is just suffering. A lot of things start happening immediately. So blood is diverted to your skin so that you can dissipate heat that way. You start sweating more, and there is a lot less blood available for other things at first. So this is why your body recognizes right away, okay, here's my pool of blood. Let's think of it as money. I only have so much to allocate to each function. So what do? I need to grow that pie. I need to get more fluid volume so that I can maintain organ function. If I'm exercising, I can supply the muscles. And I also have this extra pool that I can divert to skin blood flow for convective heat loss and also sweat. So that's one of the main things I want you to remember from today. So essentially, initially, it's super uncomfortable. Your first run or walk in the heat, you're like, this didn't feel like my walk the other day when everything was great. And it's because you are actually doing more physical work. Even though you might be slower, just remember, your body's in the process of getting used to it. So your maximal exercise capacity goes down, your core temperature goes up faster. So overall, you're just less efficient. So what happens if you actually give your body a chance to adapt? Well, number one, you want to do it really slowly. That's where people get into trouble in our environment. They might fly here from somewhere else. They want to experience our beautiful trails, and they just can't handle it. And we hear a lot of those sad stories where people just don't make it back from their hikes. So, we do need to respect the heat, but my goal here is to show you how with careful application, you actually can make it your friend as long as you know when to stop. So that's the other side of this. So if you give yourself a chance of probably, if we're talking a few weeks to really welcome the heat in slowly, you get that plasma volume increase, you actually will get your heart rate to be lower. So at first, heart rate spikes, core temperature spikes, breathing rate spikes. But if you give yourself a few weeks, all those metrics go back down for any given intensity. So in a sense, you become a better athlete if you allow that process to happen. So I think that's pretty cool. So here's a visual. I know that people are visual, so I'm not sure exactly the time frame here. I think it's a few weeks of training. This is talking about endurance training, but the same thing is actually going to happen with heat adaptation, especially if you're doing that here in this environment, and then it's both. So you get actual more liters of plasma, and you get more red blood cells. So you just have more of everything. Feel free to interrupt me, you guys in the audience here, if you want to clarify something. So I'm going to get a little technical here. I'll try to go through it slowly, but I just want to touch on everything that happens. I'm going to go to this first because this is a little bit clearer, actually. So your cardiovascular system and your kidneys work very closely together, actually in your lungs as well. So this is a multi-organ system effort. And what are we trying to maintain here? Well, really, instead of prioritizing the exercise here, your body's prioritizing keeping your temperature down. So core temperature, tightly regulated metric. We can tolerate a little bit up, a little bit down, but it's so carefully controlled because our proteins don't work if we're far outside of that range either way. So that's really what your body prioritizes, and then other things come after that. And you may recognize some of these words from medications if you happen to be on medication. So like you see ACE there, ACE inhibitors are a common blood pressure medication. So when you're exposed to heat, this system, it's a long name at the top, is activated. And it's actually largely why you'll notice that your urine is darker after a workout in the heat, because your body's goal here is to not only keep your temperature down, but to maintain your fluid volume. So we do get really hypotensive or low blood pressure patients when it's hot. We see them come into the clinic, we take their blood pressure before they exercise, and sometimes it's 80, even 70 lower as that top number. So they're pretty low. And I think a big part of it is that they're already on blood pressure meds, and then this happens, vasodilation to the skin. If you don't have enough compensation, your blood pressure might drop. So that's why your kidneys actually absorb more water and more salt. So salt is not a demon. I know that we're taught that. But if it's in the right amount, and especially if you're in a climate like this, you really need electrolytes. You really need sodium. And so your kidneys are trying to preserve both of those things. Does that make sense? Okay. This might feel like school. I'm trying to make it fun, but there's definitely some content here. So essentially, these are the things that happen. Water and salt reabsorption with that training. Okay. Again, don't get intimidated by this slide. This is really just here to show that that core temperature is really tightly regulated. Something else that you guys have intuitively felt, I'm sure, is that when it's more arid, your sweat works better, right? When there's a breeze, you actually feel that cooling happen. So that's another reason why human beings are actually really effective at dissipating heat, because we have that sweat response, assuming there is, or it's an arid breeze, right? And then we actually get that evaporative heat loss through our skin. So that's great. If it's humid, that doesn't work as well. So that is why if you are working out or just even going to a football game and you're in a hot, humid place, your core temperature is going to rise faster than if it was just hot and not humid. So something to keep in mind, you want to consider the total heat stress, which is a combination of both of those factors. And I know you guys already know that. Your cooler doesn't work as well when it's humid. Nothing works as well when it's humid. The body has a harder time as well. One other quick note, there is a shift to anaerobic or without oxygen metabolism. Why is that relevant? Well, if you are still trying to run, cycle, anything endurance oriented, you might notice that you're craving more carbs and you need more carbs on your rides or whatever your activity is. I've definitely noticed that. And it's for the brain too. So allow yourself to have a little bit more healthy sugar in the summer. We all crave things like watermelon and fruit. And there's a reason for that. Our cells are just craving that a little bit more at this time of year. So listen to that in moderation. And here's just a visual of what I talked about. So we have that evaporative heat loss through the sweat, and we have the convective heat loss that just comes from those surface blood vessels dilating, and then that heat just gets sucked off into the atmosphere. Okay, and then with sweat, believe it or not, if you get more heat acclimated, you actually sweat more. And that's if you're drinking water, right? So none of these adaptive mechanisms actually work if you're not drinking water and you're not replacing your salts. But if you do, if you support your physiological changes with that, then you'll have that extra to sweat. You won't lose as much salt through your sweat. So that's another way that your body's trying to conserve that valuable mineral. And sweating 1 liter per hour is really common in the heat. So if you are an outdoor worker or you train outside for your athletic activities, then this is, that's a large volume. So that hydro flask is almost 1 liter. So you need to be thinking about, how do I keep enough water with me during the times that I'm outside for more than an hour? I just have my water bottle with me all the time. All right. Just a quick note here. This is a hard thing to achieve here in the desert, but sometimes people overhydrate without the salt replenishment. This is probably less common than just being dehydrated, but actually, if you drink only pure water, you're in a very hot place, and you are out in that environment long enough, you'll actually get hyponatremia. That means less sodium. So this is one of those reasons why you actually need to make sure you're eating enough salt. So what happens is that concentration of ions in the fluid around the cells, if you're drinking too much water, you're diluting it. There's more salt, more ions in the cell. So water actually goes into the cell and it can explode the cell. It's kind of cartoonish, but that's what's happening. So if you have actually gained weight after your workout, it would probably take a lot to do this. But if you've done that, then you do not want to just drink pure water. You want to have electrolytes with that water. Otherwise, you're just going to make this problem worse. And I will say another setting this could happen in is if you're on certain medications, and then that could make this more likely to happen. Certain meds will actually deplete you of sodium, and so that's where you really need to watch out for this. So any questions, and you have a chronic kidney or heart condition, definitely talk to your doctor about this specifically. Everybody's a little bit different, but certain meds can make this more likely to happen. All right, we're doing good so far? Okay, you're such a polite audience. All right, so I already talked about this. A lot of these symptoms actually overlap with heat exhaustion and heat stroke, which is kind of funny because it's not really the same thing, but when your ions are off, your fluid balance is off, nothing's really working properly. So do watch out for this. Okay, now these are just some general guidelines for how much you should hydrate. It's not really going to be accurate down to the ounce. All we can do is estimate. It depends on how hot it is where you're at, how big you are, how hard you're working out. There are so many variables. But if you're going to be doing anything that's longer than an hour, probably even less than an hour because our temps are just so extreme here, you want to pre-hydrate. You want to hydrate during, especially if you're on something like a longer bike ride where you can take water with you. And you want to have water and or electrolytes afterwards. So remember, you have to keep up with it. A colleague of mine, I won't say who it is, but somebody who's very athletic that I know, he knows this physiology very well. He actually was not able to keep up with his hydration, and it was several days of not feeling optimal. And then eventually he realized, okay, I need to get checked out. And an IV with electrolytes solved most of the problems. But when you do a long effort and you don't catch up, it just exponentially gets worse. So you have to stay on top of it. Don't give yourself a chance to start getting behind. All right, I already said that. Let's have a visual here. So we are going to talk about pee because it's very relevant. You all know, I don't need you to volunteer, but you all know what your pee normally looks like. And it is actually something you should pay attention to. A lot of people ignore it. Maybe they're used to seeing orange in the morning, every morning. But guess what? That's really bad for your kidneys, bad for your hormones. It's bad for a lot of reasons. So if you want to preserve everything working properly for as long as possible, you got to stay hydrated. Now, again, you can be overhydrated. I don't think your urine should be crystal clear all the time. If you just go for a walk right now, I'm sure when you come back, it's going to be at least a little bit yellow, and that's that kidney system kicking in, preserving your fluid. But you want to make sure that it doesn't stay in that darker yellow area for too long. That's just after acute efforts outside, exerting yourself. The rest of the time, it should be a lot clearer than that. So if you don't remember anything else, just look at the color. Yeah.
Quick question. Okay, the way that you hydrate, does that make a big difference? Like, should you be sipping, your fluids rather than just gulping them down? Does that make a big difference?
That's a really good question. I think that's individual. Later on, I do touch on that for kidney patients because some people are actually on fluid restriction, which sounds like an incredibly hard thing to deal with in this climate. So if you are worried about, if you're somebody that might retain water too easily, and you know that that's a struggle, and that you have edema that you manage, then I would say sipping is better. It just kind of depends on how much you can retain. I mean, everyone has a different bladder size. I have a small bladder, but I have to drink frequently, and that's just what I have to do. So I would say, probably a little bit at a time, but if you know you won't be near water for a while, then I would recommend having more. Sometimes I'll put electrolytes in my water, even when I'm not working out, just working at the hospital. And that way I'll actually retain more of it for longer. So I find that if I supplement a little bit of electrolytes into my water and I drink a lot at once, I'm more likely to hold on to that and use it rather than it just flushing through my system. So that's just me, but that has worked for me. So I don't know if that answers your question. But I think as long as you're drinking more, it's probably good for the average person. Okay, I'll just touch on this, and this is kind of relevant for you, Tara, because you are in Colorado. We are actually at somewhat altitude here, believe it or not. We're not sea level, we're 2,300 feet, and Mount Lemmon is like 9,000 feet. So we actually have a tiny bit of altitude stress, but if you're in Colorado or even Mount Lemmon, there's a significant effect there. And so, oops, I skipped. So I do just want to touch on this really briefly for those of you that really like hiking and getting to remote places. Altitude is its own stress, so there's obviously a little bit less oxygen availability. It affects people differently. Some people just have the genetic makeup to handle that, or they've had time to acclimate to altitude. But it really just depends. So, keep in mind your respiratory system actually is involved in your thermoregulation. So you actually will breathe more when you're at altitude, right? That's no surprise. But your lungs are a membrane, and you've seen animals pant, I'm sure. And part of that is to cool the body. So when you're hyperventilating to get more oxygen in, you're actually losing more moisture through the membranes of your mouth and your whole pulmonary tissue. So you can lose water pretty quickly at altitude. Water just leaves tissues a lot faster than it does closer to sea level. So absolutely water and electrolytes if you're doing anything remotely athletic, even just a little hike if you're at higher altitude than you are acclimated for. So just a note for anybody that likes to do intrepid stuff like that. Okay. I won't get in the weeds too much here, but I did just want to say that changes are happening not just at your organ system levels. So cardiovascular, I've been talking about that. Kidney, sweat gland, all those things have changes for heat acclimation. But even at the cell level, you have a lot of changes. So you have anti-inflammatory factors and enzymes that are produced in greater quantities when you're exposed to heat for long enough. And this can be a good thing. You just don't want to go too far with it, right? But for example, if you do something like a sauna, that's a way to get passive heat exposure, and you will get some of this molecular benefit. So this is why I personally use a little bit of careful heat stress, a little bit of exposure, because I think it makes me healthier overall. I'm not saying that everybody should just go sit in a sauna for an hour or just do something drastic. You want small bits of additional time each time. No huge changes from room temperature to I'm going to go run in the heat for an hour. Don't do that, but just know all this is happening behind the scenes. And if you do it in the right amount, it can be really good for you and actually have cardiovascular protective effects in the long term. You guys still with me? Okay. I'm trying to not read all this because I know it's a lot. Okay, if you're more in shape, this is no surprise, you probably will adapt better to heat stress. If you are overweight, you're not conditioned, your heart is already starting from a slightly compromised spot. And when you have more demand from the heat, it's just a bad mix. So that's why if you're not in good aerobic shape, you want to take this really slow, slower than if you've been conditioned and you've already been stressing yourself in small ways regularly. So acute stress, including heat stress, has benefits. It's adaptive. It can actually make you live longer, theoretically, but you can't overshoot. All right, so I've talked about the physiology. I want to touch on the difference between heat stress, heat exhaustion, and heat stroke, because I think that is relevant here. If you are exerting yourself a lot and you just want to know the signs, maybe you recognize this in somebody else and you want to help them out. So heat stress is really where you want to be if you are intentionally putting yourself in an uncomfortable position. Heat stress is okay. You don't want it to escalate though. So if you're well trained, you can handle this better. You keep your workouts shorter. So if you normally run 5 miles, maybe you want to run 2, 3. If it's hotter, you should monitor yourself. If it's feeling like this isn't productive today, maybe even walk. You're still going to get some benefit. Don't expect yourself to have the same distance, same time. You want to take recovery measures after. So hydrating, electrolytes, maybe getting in a cooler spot. That could be just walking in somewhere with air conditioning, taking a cold shower. All these things help put the brakes on some of the inflammation that can happen. Heat exhaustion, this can sneak up on you. So it's mild heat-related illness. Generally, you're going to be feeling, it could be a myriad of things, but some dizziness, you feel a fast heartbeat, maybe your breathing is high. You may not have all these, but some of them will be present. Your temperature may be rising. Not necessarily in the early stages, but if you're feeling hot and you feel like your sweat is just it's not cooling you anymore, and you feel maybe a little bit irritated, there are some mental effects as well, then it's time to call your workout short, or wherever you're at, it's time to get inside. Rhabdomyolysis is something that happens with intense muscular activity. So this would happen probably during exercise in the heat, when your muscle proteins break down and your kidneys can't handle it. So it's another thing to watch out for. You can recover from that. It's just time to take action at that point. Heat stroke, I hope that none of us ever experienced that. You can be, you can recover from this, but the time is really ticking with this one. So your core temperature has risen significantly. It's a 104 or above, so it's like a really bad fever. There's systemic inflammation at this point. So in a lot of ways, it's like sepsis actually, because your heat shock proteins, which protect your other proteins, even they're melting, essentially. Everything's just melting, and your cellular structures just aren't intact. So, unfortunately, this is probably what happens when, somebody is stuck in a car. I don't want to talk about that, but, it can really happen quickly, especially if you're in an enclosed space. So, if someone was able to get to the hospital, they would probably cool them immediately and try to prevent that systemic inflammatory response from happening. So if you see anybody struggling with this, you want to cool them immediately. If they're still conscious, get them to drink. If they're not conscious, mainly you want to just get them to medical attention. So this graphic right here shows some of the differences between exhaustion and stroke. There are some similarities. The main difference for me is that with the exhaustion, your body's mechanisms of cooling are somewhat working. So you're actually still sweating. You can sweat. You have enough fluid to sweat. Your heart rate's up, but it's still doing something. Over here, you're not even sweating anymore. So in a sense, it's like your body is giving up a little bit. So you really want to stop that cascade from happening as soon as you can. All right. So touching a little bit clinically, I know a lot of people deal with various heart conditions. They're very common. Everybody is going to adapt to the heat somewhat. You can't avoid it if you live here because you have to walk to your car and back, right? Even that can feel like a challenge. So you just have to know what your threshold is. With congestive heart failure, some neurological conditions like multiple sclerosis, even hyperthyroidism, there is an increased sensitivity to heat, but also an impaired ability to get rid of that extra heat. So, and some of these medications also impair your body's ability to actually get rid of the extra heat. So I'm just going to go through a few different situations. So we see a lot of patients with CHF. There are many different presentations of this. There's systolic heart failure, diastolic, but whatever kind it is, there's an impaired ability to circulate blood effectively. So your cardiac output is just not where it really should be to get your cells the oxygen they need and to offload the metabolic waste. So if you have more work to do in the heat, then having a reduced capacity but more need is a bad combo. CHF patients particularly actually have an impaired ability to dilate their skin blood vessels. So that's probably the biggest takeaway I'd have clinically. This population, for whatever reason, it could be a combination of the medications as well as just the neurovascular innervation. They don't dilate, probably to maintain their blood pressure. The body doesn't want it to go down too much. So people with this condition, take care. Doesn't mean that you're a wilting daisy. It doesn't mean that you should think of yourself any differently. It just means that be aware that you may not feel yourself getting as hot, even though it's happening. Your body is not offloading that heat quite as well. Coronary artery disease and MI, heart attack, they go hand in hand. But essentially, the heart muscle itself is not getting enough oxygen. It's not getting enough blood flow. So same idea here. The heart itself is compromised. So if the heart's compromised, it can't effectively circulate all that extra blood, which needs to go to the skin, the sweat glands, and maybe the muscles during exercise. So Again, it's just an FYI. Take it more slow than you would if you didn't have this. Essentially the same thing with an MI, heart attack. Fun fact, your body might circulate 2 to 4 times more blood per minute when it's hot. It's a lot. It's a big difference. All right. And then also neurodegenerative and autoimmune conditions, there's also heat intolerance. So just FYI, talk to your doctor about how your medications might interfere with this. Okay, so what's the point? What's the point? What do you do? Well, it depends. Are you still an athlete? Are you dealing with a heart condition? Are you somewhere in the middle? Well, you have options. So you want to hydrate throughout the day. This is a no-brainer. You probably want to have a little bit more conscious intake of electrolytes. Gatorade is very popular, but there are a lot of other brands out there right now. The sugar actually is helpful. So a lot of people are looking for low sugar or no sugar sports drinks. And if you're diabetic, I understand, but just so everyone's aware, the sugar and the sodium work together to allow more water to absorb into the cell faster. That's a big reason why I do supplement and just dilute amounts, sometimes throughout the day, especially this time of year, just because it's so much more efficient. I don't have to keep chugging water. I get it to my cells right away. So again, keep that in mind. Allow time. Allow yourself 4 to 6 weeks if you are actually sticking to a training plan, like you have a goal race in mind or something like that. If you are a worker that has to work outside, my partner is a solar installer, so he's actually on a roof or on the outside of a house until about 3 in the afternoon. So the only reason he can do that, I want to study them. I don't have my grant yet, but essentially their bodies have been adapting slowly every day of the year, and they also start early in the morning. So all those heat adaptation responses have a chance to kick in. But if you're not that type of special individual, maybe you go out earlier or later. You guys are probably already doing that. Maybe consider your strength training. Maybe do some things inside. Make that a phase in your training plan. Strength, resistance training, myofascial, other things that are complementary to your aerobic conditioning, water fitness, anything that can keep your core temp down. So this is people that, just the average Joe that doesn't want to try too hard to get good at dealing with this. Here's a quick visual. I thought I'd be a little funny with it. So the average Joe, cardiac condition Joe, and then the athlete or outdoor worker. Exercising or being outside above 100. If you are just a regular person, reasonably in shape, I'd start with 30 minutes, maybe a walk, 30 minutes or less, and maybe just increase that in small amounts. You don't want big changes. I wouldn't go from 30 minutes to an hour, let it be in small intervals. If you have a heart condition, you want to avoid being outside this time of day. If you are, let's say, at an outdoor ceremony or a sporting event, make sure you have cold water, sun protection. Make sure you have the ability to get inside if you need to. You start to experience those adverse symptoms. And if you have no choice, you're training outside, you're working outside, make sure you monitor yourself, take as many breaks as you have to. There's no shame in that. If you need a break, your body needs a break. So increase that time outdoors gradually. Hopefully your employer knows that because the CDC actually recommends that. So you can cite that if they give you a problem. Water electrolyte intake. So before, during, and after, you want to consider electrolytes if it's an hour or less. Kidney heart conditions, I say small sips just for that chance that you are on fluid restriction. Your kidneys can't process a big volume of water all at once, but at least that way your mouth is getting that cooling. Big part of the thirst response is from our mouths feeling dry. So at least having that steady, small flow might make you feel a little bit more comfortable. And then if you're outside and you're elite, then you want to be drinking at least 8 ounces 3 to 4 times an hour. And then probably a lot more at the end of the day because it's pretty hard to keep up. You still will need a large amount at the end of the day, even if you've been drinking the whole time. Ways to make it easier. I'm a big fan of sun hats, sun shirts, sunglasses. I just keep them in my car whenever I go for a random impromptu walk. I think that goes for pretty much everybody. And a cold bath or shower afterwards is really nice if your pipes even get that cold, and they honestly don't that often. All right, and that is pretty much it. So I have time for questions now.
I have a question.
All right.
Is there any difference in drinking a certain temperature of water in the summer? Is ice water better, worse versus room temperature? Does your body absorb things differently? I'm just curious.
That's a good question, and I probably should have looked that up before. I think there is some research that shows that if you drink colder water before an outdoor strenuous activity, your core temperature will stay lower for longer. I'd have to go and find that specific thing, but I have heard that. So I think even if it's just like subjectively you feel better, it's probably worth doing that, because you know, some of these feelings maybe are not quantifiable, but if your nervous system is calm, then you're not going to hyperventilate. You know, anxiety can cause your temperature to go up, your heart rate to go up, breathing rate to go up. So if you can keep yourself calm, I think that's worth it. And if cold water works for you and it feels good, then do it. But I am not positive on if it's considered bad for you to drink something too cold or too hot. But I know people have their opinions on that. So
this might not be a fair question to follow it up
Okay.
with, but I'm going to throw it out there.
all right.
Say you're in a pinch and someone is experiencing maybe the exhaustion, the heat stroke, those symptoms, and all you have is like a warmer water, maybe it was in your car, it's borderline, it's not hot, but
It's not cool.
Is it better to get that fluid into a person if it's not at least like room temperature, or is it better just to wait until you have something?
That's a really good question. My instinct would be to give that to them. I'm not a paramedic, but I think at that point, the blood volume is low. So more important than the temperature even is, okay, this person's hypovolemic. They literally don't have enough fluid to keep their arteries open. They're not circulating oxygen to the cells. So you really want to bring that volume up, because when they get to the ER or the ICU, they're going to get fluid immediately, like saline bags that probably have electrolytes in them. So that's what they're ultimately going to do. So if you can get a head start on that, that would be good. So fluids, cooling, call 911. Yeah. But if they're conscious, they're probably exhausted rather than in heat stroke, you know? If they're not conscious, it's definitely heat stroke. So, okay, that's a good question.
Can you just break down a little bit how sugar and salt actually helps the red blood cells absorb water faster? So, give you an example. My mom has pretty severe dehydration. We got her some of the liquid IV.
That's what I use. Yeah.
And the first ingredient is sugar. And
Yeah.
She didn't want to take it because
Yeah.
she's like, it's just sugar.
Right. Yes. So that I've heard this happen many times, and I actually use that brand. So it's a misconception. We're taught no salt, salt's bad for you, sugar's bad for you. It's all contextual, right? So when the salt and sugar are suspended in solution with water, it has different properties than if you were to just eat a bunch of sugar or eat a bunch of salt. So when it's in that solution, in that concentration, the ratio that brand uses, and I think every brand has their proprietary ratio of carbs and salts and all that, but all of them are going to be around 10% carbohydrate for the volume. It depends on how much water you add the powder to. But if you really want to know what's going on, so in your cells, it's not just red blood cells. I think it's many different types of cells. There's a transporter that has sodium and glucose. There's spots for both of them. So it's called a co-transporter. And so if you have the right ratio of both of those things present, it actually drives water into the cell faster. So I've had a lot of people say, oh, yeah, it is just sugar, but it's sugar with a function. So I do support using that. If somebody is a diabetic, I think they probably still need a little sugar, but they shouldn't go heavy on it. Like I take those packets of liquid IV and I use maybe a quarter, depending on what I'm doing. If I'm going to be like really like running in the heat, I'll probably have the whole thing. But if it's just a little bit here and there, I'm going to dilute it because it is very sweet. You're right. But tell your mom there's a function to it. So that's a great question. I'm glad I actually had a specific thing ready for that. All right, are there online questions? Not yet. All right, easy. What about you guys? Okay, well then I'll ask you a question. So what category would you guys put yourselves in? If not even trying, somewhat trying, really trying to make the heat your friend. Yeah.
No, this is very helpful, and I understand some relationships now that I didn't understand before. But one thing I will say, as an older person, I have lost my thirst. Meaning, you know, the water stat, for lack of a better term, I think gets faulty as you get older. You can't rely on being thirsty to tell you when to drink. You just have to
Right.
impose a kind of a discipline, and that
Right.
has made me feel better. And this flask is a flask, so I'm it's my little buddy.
It's your companion now. You're going to be really sad when you dent it. That's what happened to me. And you get another one. Yes.
Oh, I see. That makes sense.
They help them. Yes. They do make a big difference. So that's a really good point. A lot of your thirst response is neurologically regulated. And I think there's some hypothalamus involvement, especially with temperature regulation too, and the brain stem. So these are very like basal, like reptilian brain things. So these are the parts of the brain that keep you alive. So thirst, hunger, breathing rate, heart rate, all those autonomic controls. Luckily, we don't have to think about them very much. But you're right. Some people feel thirst. Like I feel thirsty probably too often, actually, because you can condition yourself to drink water maybe too often. So I'm not hyponatremic, but I definitely like that my mouth doesn't feel dry. So I have water with me most of the time. But I think the urine is really where you need to pay attention. So if you don't have an adequate thirst response and you're feeling tired, well, being tired is probably the first thing you'll notice. Oh, I'm fatigued. Usually if you drink some water, you feel better. But if your urine is, I'll try to find that slide again. If it's, a darker than a light yellow, then that's a very clear indicator that your kidneys are working a little too hard to retain sodium and water at that point. So like I said, that darker color is really only normal when you have just been outside exerting yourself. Or maybe when you wake up in the morning, some people, the first urination of the day is going to be darker because you've been sleeping and you haven't been doing other things. But other than those two times, I don't think it's healthy for it to be in those darker ranges. So I think a lot of people would relate to what you're saying. They just don't pay attention. So living here, you have to be on top of it.
Can you have long-term kidney damage from that?
I am pretty sure you can. I don't have a citation for that, but it just makes sense to me intuitively that if you, it's hard to say it because some people water fast, right? In Ramadan, people don't even drink water the whole day until the evening. So humans can do a lot. I mean, we can ask our bodies to do a lot of things and we can recover from a lot of it. But for the average person, I feel like this would be harmful. It could cause acute kidney injury. And, it's about longevity, right? Do you want your kidneys to work well later in life? Because if they don't, then your whole fluid balance is thrown off. So I think it's good to allow yourself to feel things like hunger and thirst, but to not let it persist that long. You can be hungry a lot longer than you can be thirsty, right? So water is certainly way more important. So it's like oxygen, water, food. So good question. Is there any other graphic you guys wanted to look at one more time? Not really. I think this one is cool because it shows that you gain fluid, which is cool. Because it actually helps you be a more functional human being. So, all right. Well, thanks so much for your time. I hope it wasn't too much like school. All right. Great. Thanks to everybody in the online audience. I appreciate you tuning in.